It's 10 o'clock, we'll open up the special session, April 21st, 2020. As always, shut off your cell phones and let's do the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so our special session today is to discuss putting this committee together for the reopening of Lake County / Oregon, and also to discuss the reopening of the courthouse within the guidelines. So before we get into the committee and the appointment, we had quite a discussion last Friday on the need for the courthouse to be open. And I think both of you individually have heard some of my thoughts or overheard, or my voice was quite strong, is the courthouse and the opening of the courthouse. We need to be leaders in helping get Lake County reopened. So my opinion is on the courthouse with screening is that we need to get open back up. And so we sort of got hit on Friday, at least for me, it was sort of cold on most of that. We haven't heard too much about the ADA and all that. That's part of it. But the courthouse itself opening for all operations, not just the court system, but for departments and everything, I believe we need to do that. So, one of the suggestions was to have screening at the entrance within the guidelines and use departments. What my suggestion was, off the top of my head, was temporary part-time person. We was worried about the cost of that. After I rethought that, one thing that would do would possibly put somebody to work short time, right, that doesn't have a job. We should recover that dollar through the COVID-19 dollars later on. So that's interesting to me individually. Put somebody to work, even if it's for a week or two. Help out our community in some fashion. But the main thing is to get people coming back through the doors to our departments. Yesterday, I brought in a payment for a person that wasn't allowed to come in, so that their payment made it through. They should be able to come in if they pass screening, and should be able to get to our departments. So, with that said, that's where I'm at. We haven't been able to talk for each one of us individually, other than a little bit of discussion. And I'm sorry to not acknowledge people on the phone. I don't know who's all on there, but as discussions go along, please feel free to chime in. So I'm interested in both your guys' thoughts on reopening, and then we'll open it up to our department heads and others.
I don't know if we need right now somebody screening people. I think if we have a sign put up that says if you've had sickness in the last 14 days, please don't come in. Call it macaroni. But I'll get into this other stuff as we go, but that's just my personal opinion on that.
Yeah, I'm kind of in the middle on it. I think I concur with the fact that it may not be necessary, being that if we have those signs there, people can make their own decision on whether or not they want to come in or not. And if they have a need to come into the building. It's just, I also am on the other side of wanting to protect our staff, our departments, and wanting to make sure that that's there, so at least their concerns can be met. With by having someone at the door to screen people, to just check, there's a check and balance kind of in that, to make sure that and it's also providing an additional service to our community.
So if you guys are game for that, I'm fine with it.
How would we structure that exactly, though? And because it would have to go under another department, or it would go directly under
Well, I think that, there's multiple ways to look at that. We have our facility department, which is Dave. We have our administrative system, which is Melanie. So a person could be under the guidance of those as far as where I'm going.
I'm at the point where I believe that it's prudent to start opening at least our building up to where people that have genuine needs, we can meet those needs. The fact that we have the intercourt, the circuit court upstairs that is by law required to make sure that there's access to that all business days and that people can come in, and they're coming into this building the way it is right now. We're actually more restrictive than the state. And the question is whether or not that's actually necessary when it's impacting our community. We want to, and if we're going to open up though, we definitely do want to have some sort of checks and balances, I imagine. So
Well,
I'm just there to start moving forward.
the reason why I support the screening is because it follows what we're doing. And I have to say our nation, our state, our county, our people are doing good about social distancing, about doing things. We flatten the curve across all of Oregon and everything. And so I believe that we haven't had a positive case here yet, and we will have. It's going to be here. So if we implement, whether it's a week or 2 weeks, or we look at it every week, some screening, it's pretty simple, questionnaire and screening, and let people in. And we're still doing the social distancing. We're still supporting people to stay home if they're sick. Whenever Charlie hiked in the screening for circuit court, there was a couple turned away because they didn't pass the screening. And so I guess where I'm at is for protection of our employees and for operations is the screening makes sense to me at this point. We are so fortunate for the way that Lake County's reacted to this with the social distancing and that it hasn't got here yet. But it will. I really believe it will. Looking out at our public health director.
I kind of am under the impression, or at least the understanding, that it's here already. So
Yeah,
that's,
find it.
Yeah.
They're trying.
So
I have a thought on that.
Okay, let's open it up to.
So the purpose of a screener is to protect you from somebody who may test that may be infectious because you're already doing screening of employees. I feel as though you probably don't need a screener. You need to encourage anybody coming in that they need to wear a mask. And if they don't have one, then you provide them one. Because you're just trying to not get yourself infected. And you, it's through coughing. We don't use a screener at public health. Stores don't use screeners. School doesn't use screener. The hospital does because of where they are. I feel as though if it makes you feel better, you guys can do that. I don't know that that's necessary. But it is necessary going forward. I think the next step is people are going to have to wear masks when they're in places. So if they cough or sneeze, it protects you. That's the only reason why we wear a mask. It's not for me to not get it. It's for me not to give it. So I think if you encourage people to wear masks, that's probably appropriate, but it's your call. If they screen positive, then you would recommend them to go to the screening process at the hospital, or would you, there's next steps. What do you do with the data you're collecting? Then you have data you need to do something with. Whereas if you say, please just wear a mask when you're in here, that makes it easy. And we can get some more cloth masks that you can donate out. I don't think that you're going to have a ton of people coming in still at this point in time. Just a thought.
how would we structure that then? Because if we don't have a screener, you're going to have someone come in. And
Right.
You're not going to have a
So,
mask.
so whoever is wherever they end up
Wherever
needs
they
to
end
have a bucket and say, please put this on while you're
yeah,
here.
okay, that's where I was going with that.
Yeah.
How that would,
You could do it at an entrance, but they probably won't, you
right.
know, but, I mean, that's just a thought.
You're
So-
saying like
so
the,
that's-
the mass at each department?
Whoever that people come and visit,
And we've
sure.
even talked about like, partitions. and
Yeah,
stuff,
they're
like the
trying to
plastic.
put that up at
Yeah.
the hospital, as you've heard, for the admitting people, just have a partition when you talk. So, I mean, it's just easier than trying to staff, I think, and it's not even really the financial if you get reimbursement with that. I don't know, that's just kind of my thought.
So, appreciate the thought. And I'm one that sort of talks both sides of it. So
Uh-huh.
if we require or say that you're gonna wear a mask, do all of our employees also wear the mask?
Well,
And then,
yeah, it's
we
good practice
have
if
that
there's two
side.
of you,
then if they take that mask off
right,
and they go use the restroom,
uh-huh,
and they put the mask back on, every place they touch now is contaminated because you're not supposed to touch the mask when you have them on. Every time you take it off, if you are the one that has it,
right,
everything you touch after you touch that mask
there's
is now
mask etiquette,
contaminated.
sure, yeah,
So masks are a good idea, don't get me wrong,
no.
but it's not a guarantee.
No, but I think that you'll find with most plans going forward, they're gonna require us to have people wearing masks. And again, I always say, let's lead by example. If that helps us to get things open, and if that helps us to move forward, I don't think it's a big price to pay.
So other thoughts from department heads, elected officials on opening the courthouse? Do your employees have fears of opening up? What kind of protections are they wanting? Jake, I'm looking right at you because of you deal with the clientele, you've already implemented some things, but your clientele is going to be coming down the halls possibly. You're still gonna probably try to do it out the back door, but there's gonna be some of them who say the courthouse is open, I'm just gonna walk down the hall.
Well, we talked about that this morning at our staff meeting, and that's gonna be hard to monitor. Because when we have 3 staff meeting with clients throughout the day, we could have quite a few people sitting in the lobby. So we don't get that, and we maintain the social distancing. My staff are interested in meeting with them in the community, meeting with their clients in the community. We have mobile access now. We're able to work remotely. So some have talked about meeting in the town parking lot with clients, maintaining social distancing, but trying to get some type of normal back, whatever normal is. We've had some folks come to our back door and we're taking oral swabs on them, and the expectation is we have masks on and we have gloves on when we're interacting, doing that stuff. And it's what they feel comfortable doing, that I'm instructing them to do. So as long as they feel comfortable meeting with folks in some kind of setting outside of the courthouse, we're comfortable with. But it's hard. Our population isn't the most responsible, so if we ask someone to show up at a certain time, probably have 3 people show up at that time, and we have more than just one sitting in the lobby. So we're trying to get away from that right now.
So the uniqueness, and that's only the adult side of it. If we don't monitor the door, they're going to come in because they're allowed to. And then you got your juvenile side downstairs that's allowed to come in. So
There,
if we fully open up to the public, there's some uniqueness just for your department, your 2 departments to be able to manage to that.
juvenile staff have indicated they will meet outside. There's some different places they can meet, do some things one-on-one.
But if there's a screener, you can stop them from coming in, even if, say you have an appointment for 1 at 10 o'clock and 2 show up, that screener could hold one of them back outside and come in. I don't know if that's a value or not, if that's part of the tool you need. There's some uniqueness. If we just open up the door, public's going to come in.
I don't think my staff are more interested in meeting with them out right now. The weather's nice. They can meet with them in
absolutely for the one that's gonna listen to you, but if the door's open, there's contingent of people that you deal with that's just gonna come in. And you know that.
Fortunately, our clients understand the courthouse is closed, so we haven't had anybody come in unless we call them. So that's gonna be incumbent upon my staff to maintain that communication. Whether there's
So
a
you
screener
don't
or
see,
not,
you don't see the door being open a problem? Okay,
if we won't be meeting clients here unless we absolutely have to. And it'll be one, and that's it.
okay. Mr. Hall, are you on the phone? Is there anybody for the sheriff's department here? I'm looking at him as an incident commander, not as representing, the voice for the undersheriff or the sheriff, unless you wanted to take on that role.
Don't want to take it on.
Because of, when we open the door, there's a lot of people that want to get their, CCW. They're wanting to interact down at the window, and it impacts your site also.
I think Undersheriff Hall will be the appropriate one to talk to about that also because of the facility security and stuff like that too.
Yeah, and so I'm just trying to figure out, if we open up the door, how we do that without people just wanting to come to do normal business. Because there's a segment of people out there, it's not huge, that are naysayers to the COVID-19, and they don't care about social distancing, but the rest of us do care. And so there's that element also. And when we open up and they go to the sheriff's department, they can get their CCW from different other states come in and go in there to get an Oregon CCW. So now we've brought in people that are traveling and everything also. So,
I can see the benefit of having a screener, but it's incumbent upon my staff to know when their clients are coming in, if they're coming in, or meeting with them, giving them instructions to meet somewhere else. We don't have to meet here now per se because we have some remote access. So we're able to meet and do business outside the building. We haven't because we haven't gotten that far yet. We're slowly getting into it. And we're not gonna flood the gates, so to speak. We're gonna continue to day by day, step by step, but we have to get back to some form of supervision, meeting with folks face to face. Doesn't have to be here in the courthouse now, because if we are able to work remotely.
Charlie, you have a contingent of people that come to your office that some of them are elderly and
We go through the screening
Underlying.
process
so.
and it seems to work, but we have them masked if we have enough masks. I mean, if they're coughing and they say that, they just have a cough and an allergy, well, we're not going to take that, with a grain of salt. We're going to think serious about it, so they'll have to mask. We'll just have to get some masks. I like the idea of having masks handy. And then that way they have a choice and we have a choice. But yeah, we do screening process. We've been doing telehealth. We've done everything we could to do everything remote and do house calls. And on the house calls, we're really careful on that too. If they have a bunch of family members, if they're sick, we don't go in and see them. We'll make an appointment and possibly do some kind of a teleconference or a phone conference with them.
And that's the way we've been operating. Appreciate that. But if we open the courthouse, what does that mean for your department? How will you?
I'll still do the screening process. I'm not, because I have a lot of elderly, and there's a lot of them that are sick. They do have respiratory problems, and you don't know. Every day is going to be different for us. So we're still going to stick with the screening process and go as if this COVID's still active around here, and protect them. It's more about protecting them. We feel pretty good in our office on protecting ourselves with masks as they're coming in. Like this morning, we masked them. They didn't have any problems, but we didn't want to take that chance because this is new, opening up everything. And they came in, did the screening process, and did business, got it done fast and clean, and let them go back. So it's been working out pretty good for us so far. And it's the same way in North Lake. They come to the door, we do the screening process. They mask because there's masks available there at the door, because mental health obviously has a little mask stand there, which would be nice to have everywhere we go to a business. And that way, they can just grab a mask and come to the office and talk until this thing's cleared up. And if that's possible, that'd be great. Because that way we can go anywhere and we'll have a mask available.
Mr. Berman, you're tasked with, I know that some departments were talking about putting shields down and everything. Can you give us a little bit of
No,
have you
most of the
heard much
departments
from the
I talked to-
departments and what departments are wanting?
Most departments weren't interested, well, like sheriff and Jake's office, they have the window already, so they can interact there and they don't want any glass. I talked to, assessors, talked to Dave, he doesn't want nothing at this time, any kind of protection shield. And I offered him, told him kind of what we wanted, and the only one that is interested is the clerk's office. She wants a divider, a glass from her counter around, so she's separated from the public when they come in.
So if we open up, I don't think you've really
I did
done
not
a
address
whole
them.
bunch, but are we gonna put tape down every 6 feet? When people come to the counter, what are we gonna implement for the social distancing?
So that's what we will have to do. We'll have to look at that once you open it up and put whatever it takes to keep them social distance.
That's what I'm seeing in the businesses when
Right.
we go there is that I've heard secondhand information that even people from the state have been here checking from construction outfits to other places and checking if people are adhering to the social distancing. So if we open up, we definitely want to get those things in place, I would think. I don't know what all that means. I go to KBE and they put your parts back and forth by 6 feet away, and they roll a cart back and forth when you're buying a part there. So I don't know what it means.
Well, I guess we could also put signage on one person at a time in each counter, like the assessors, you can only have one person standing there at a time. You wouldn't want people piled up in there, I'm sure.
So anybody on the phone have any thoughts?
Well, Ann actually had something.
Okay, hold off on the phone. Go ahead.
No, I think I was thinking like Judy said, there's not screening at businesses right now. So I think the masks and social distancing is filling their needs, and it seems like it should
So it would be
fulfill our needs
sufficient.
as well.
Okay. I just wanted to acknowledge you had your hand up, so I wanted
Thank
to
you.
cut back to you.
Sorry, I didn't see you. Anybody on the phone have anything they'd like to add or thoughts? Okay.
Is there someone on the phone?
I've heard.
Well, there was, it beeped a couple times.
Yeah.
We have several people on the phone.
So, commissioners, what are your guys' thoughts?
Anything on this?
If we provide masks, do we have enough masks to provide?
Depends on
I think that's a great question. If we just open up the doors, we're going to provide masks. Who's going to be the mask policeman around and tell people you have to mask?
I think that would be up, like Judy said, up to the
And all
individual departments that they go and visit, like, hey, would you please wear a mask while you're in here, I'd appreciate that, So you're not giving me something, that way the department heads can have that, and it's like, there's the masks right there, I'd like you to wear that. And we still would have the rule, we can't, if we're looking at not having someone at the door screening people, we still would have the rule of, look, if you've been sick within this time frame, you've been in contact with someone with a verified, confirmed case of COVID-19, we recommend you to stay home, not to go to the county courthouse anyway. And I would hope that people would adhere to that. And if they don't, obviously, if someone comes into one of the department heads' offices coughing and everything, and say, okay, look, you gotta put a mask on if you're here. And so, yes, I think it's doable, but like you say, we have the masks. We could reach out to Darwin and see if Candace would be interested in making us a couple dozen.
We have some too. In fact, we've had multiple that I just put out yesterday. You can stop working on them for us because I've taken over 500 to the hospital.
Okay.
So, and I still have some at Public Health, and I still have some people who would be willing to make them for us. Would you have a rough number about how many we might need?
I haven't put no thought into that at all because of it pushes my
Right.
thought into reopening Oregon, and our hospitals and our healthcare and our dentists and everything have to have a certain amount of PPEs available.
So I would never have people wear medical masks. It would only be and a handkerchief. It would only be handmade mask, or if they purchased them online,
Right,
then
so
a
we're
cloth
only
mask.
talking about the handmade.
So
masks.
only cloth masks. And the other thing is, I think if we're asking, I think it needs to be in the media that if we go forward with this, that everybody should have a mask that they carry with them. So when they're going in and out of buildings, they're putting it on. And hopefully what will happen is everybody will have a mask with them.
So
and
there
they
won't-
just
there may
wash
be a
it
need eventually, yeah.
And eventually, because we know already the hospital staff, the stores, I think some of them are wearing masks. I think a lot of masks are out there. We would be surprised if we asked people to please wear their masks. A lot of people will have their own already. But we could certainly help with that if that's something you wanted Public Health to help with. I could reach out and get some more. I probably have at least 40 sitting over there
But we
that
could
we
probably
could
take,
start with.
okay, so we could probably take a couple dozen at least, I think.
Yeah.
That would probably get a couple masks in every department, and so they'd have that at their disposal if they're going to. open
And then
back
if you
up.
give it out, then they just keep it and you would request that they continue to wear it out in public.
Yeah.
And
And if
we
we
could
need more, we'll
get-
reach out to you and we'll get a few.
Yeah. There's some teaching guidelines that go with it that I could share that if they gave out a mask, they could offer to give, this is how you take care of it, sort of thing.
Okay. I like that. Looking for a consensus.
I don't know if I'm clever people do that. I think we should have a choice.
It's
Of-
hard.
of-
Yeah,
Of what exactly? Of the-
Wearing a mask or not.
Oh.
Well, you know, on the veteran side, we get a lot of people that come in from out of county to come get assistance. And I think that we should judge their integrity when they come in and you see them coughing. And we should have the right to tell them they have to wear a mask. Because, I mean, I've got 395, 140, and we've got a lot of homeless even starting to come in that need assistance. We don't know where they've been, and they've been sick. So, you know, we have to think about it a little bit different on my side. And I'm sure they go through the hospital the same way if they're sick, you know, coming from, you know, down south. But the homeless are just now starting to come in. I've seen some of the campers coming in, heading over towards Christmas Valley that I've seen there before. And they're coming from, you know, Arizona, California, and we don't know what they've been exposed to. And they just walk right into ACE. I seen them the other day. I couldn't believe it, you know. And yeah, I think there's some, you know, things that we have to really watch out for.
I agree with you. My problem is I'm kind of like dead center in the middle. I could see the good in having or making people wear masks. But I also see it infringing on people's liberty. You know what I mean? And so I'm having a little bit of a struggle on.
And that's what I kind of thought maybe there's a happy medium there of allowing the department heads the ability, you know, to make that choice for themselves. Like, look, you're gonna be in my office, you know, wear this mask. And we have to take responsibility for making sure that this area is cleaned down and sanitized. And
I think to open up, it's gonna have to require masks to be able to open up to convince higher ups.
I agree.
okay.
I think we're gonna have to play that game to be able to do so.
I think
So
it's
you're making a requirement.
I personally think it's an easy gift. Do we like to wear it? No, I don't like to wear it. You know, but if it moves things forward, why would we die on this hill. Let's just do it and move forward, if that's what it takes. So, I don't know. I think that if we're asking for the medical community to help us, then we need to listen, and this is one of the big things that they have said, is they feel that people should be wearing masks. And hopefully somebody will come today and they can tell you that. I'm not sure, I'm just guessing with that. But, and I also feel that we have to lead by example. I have people calling saying, did you know there's a Klamath delivery truck here and they're not wearing masks? And I said, are you? No. Well, then why am I gonna go make them? When every person in Lake County is wearing a mask, then I'll start policing and saying, you can look around, everybody's wearing them, please put it on.
Right.
But I'm not gonna do that when the majority is not doing it. So, that might be part of our plan that we talk about later, but I'm with Daniel. Everything I hear, I don't know that this is a pass. I think we're gonna deal with it.
I guess this was some of our frustration though, that's like right there, the Klamath truck, we have OSHA or MSHA come over to Lake County from a county that's got a bunch of cases
Right.
to a county that has 0 cases and start making contact with all of our businesses.
Right.
And they come into offices and they're not wearing proper PPE, they're in 95s.
Well, I
So,
guarantee you, there's some Lake
that's-
County people going into their county. And we might not have it on the docket that we have it, but we might.
Yeah.
And I would, if I had to go somewhere, I would hate to be judged for going. And I refuse to judge people for coming here, especially when they're bringing us supplies to our grocery store. But again, lead by example. If we all want them to wear masks, then I kind of think that we kind of have to do it too.
Interesting conversations.
Yeah, just
I'm still at least for the first week with screening and recommendation to wear a mask. Not mandatory. The screening should eliminate the honest people that show the symptoms. One of my questions is if we've done the screening, and this is to you, Judy, is it legal and can we take their temperature? And do you have the device that the new modern ones? Is that something we can do?
I don't know that we can do that. I think they can do it at the hospital because it's a hospital guideline. I don't know. And again, at public health, we're not doing that. And so it goes back to the mask again. And I think this is what the physicians have said is if they do have a fever or a cough or a sore throat and they're just not wanting to say that, then they're wearing a mask. I don't know. And then you have to have people comfortable with taking people's temperature. And then if they say no, are you going to say you can't come in? Again, you're taking away a right. I personally feel, because we've talked about it and looked at it, and this is why we asked for volunteers for cloth masks quite a while ago, was I felt that this is probably the road we were going to go down and we needed to be a little prepared. And I think if you wear a mask, then you don't have to quite worry so much with them being honest and taking temperatures and stuff.
So I've heard a couple of times that it's going to come down from up above, that masks will be required.
That's what we're thinking.
And looking at reopening Oregon, I haven't fully digested all of it, but I haven't seen where that's part of reopening Oregon coming from the top down yet.
Right.
And
I don't know either. I just, it seems to be part of the conversation is always masking when you're out or masking if there's more. You don't have to wear a mask if you're in your room by yourself. If somebody else comes in, then the guidelines are it's good practice to mask. Yeah.
I went into
I
local
don't
business yesterday intentionally to just sort of look around and see. And I think there was probably maybe 1 out of 20 that had a mask.
Right. And is that good or bad? I don't know.
We
People
have
look
0
at me like
cases
I have
here.
a disease.
I don't know
Yeah.
if it's good or bad.
Yeah, it's a little disappointing to me that they have asked for us to do that and people aren't doing that. But there are also people who are complaining that we're not moving fast enough to get things open. You know, you have to give a little to get some sometimes, and I make my family wear a mask when we go out. I mean, I'm the public health director. So I feel as though you can't make people do it at this point in time, but you can recommend it, and that's what they're asking. I don't know.
Well, and that, I guess, and that might be where sort of Mark's struggle is you said the same thing as me, recommend it, but we're also sitting here talking as that's gonna be mandatory if you come into a court.
Maybe, I don't know.
You know.
You guys are more in contact with that than I am.
Yeah, we go from here, and then we go to the parts store, we go to Safeway, or we go to Ace, and it's not mandatory.
So Daniel, how many hours have we talked about masks in the last month?
How many hours are in a month?
I mean, seriously, this conversation.
I mean, it's 90% of our
is
discussion is
nonstop.
mask.
Every day at every meeting I'm at. So I just feel like we're putting a ton of time into it and dragging our feet horribly. And somebody higher than me is gonna make a decision whether we are or we're not. And we'll move forward from there. Yeah, I don't know.
For those of us that we make complete circles, we listen to, we have all the same arguments. But when we look back at the numbers and people are not wearing their masks, the number of people even in the state of Oregon, what is it, 75 or 76 that have passed, and the numbers that have been infected, is mask the reason why? It's not saying that because people aren't wearing it.
Yeah, I don't know.
You know, so I do also struggle with saying you cannot come in here unless you're masked.
Right.
That's me. I will go with what our board wants to do and follow. But for me right now, it's I'm comfortable recommending the mask and doing the screening.
Well, and that's what our national coronavirus response report is recommending. And the thing is that, like Daniel says, we have to go get through phase 1 to get to phase 2 of reopening. And if it takes us to wear masks to get to phase 2, because phase 2 is the start of relaxing these requirements. And if we don't comply with phase 1, it's gonna be hard enough to
Jeopardize
reopen
the
it.
ability to get
Right.
the phase 2.
And so, as much as I hate to say it, I think we should be wearing masks. And my thought is I agree with you 100%. I don't really think, not very many people are wearing them, and we're at 0.0003% of the population that have COVID. But to satisfy the national and the state people, I think we need to comply to get to phase 2 so we can get our businesses open again. And
So
Jessica had a question.
Yeah, I'll get you this. So with that, Commissioner, if we do say you will wear a mask, that puts us in another position of enforcing it. And who and how.
So this is
what do we do if somebody does?
This is a recommendation. This is a recommendation. That should be our recommendation. It's not.
So when somebody comes in the courthouse, I'm talking courthouse operations, not Safeway or anything, and doesn't comply with that recommendation, now we set in the leadership role and we have to address that. Whenever somebody comes in and says, that person's not wearing a mask, I am, I want you to do something about it, how are we going to handle that? That's plot as we make things mandatory. There's also enforcement that comes with that, and that's the struggle that I have.
So how about this? We go ahead and do the person at the door of the screener. screener tells them, we recommend you wear a mask
And have masks available.
and have masks available, they hand them a mask. It's a recommendation, just like the national is, just like the state is. It's not required. You see what I'm saying?
That's exactly what I wrote down. But anyways, yes, I struggle with the enforcement side because we as politicians and local leaders, whenever something isn't implemented that we say you will do, there's an expectation that we will address it. And you guys get the same phone calls I get. And the same, by all you guys said this, why haven't you taken care of that? And so that's the reason why I lean to the recommendation side more than absolute side. That's me. I don't want to overlook Jessica. Anyway.
I just had a comment. The governor's last press conference, she did address this and kind of hint around to, it was brought up that there was enough mask usage for possibly opening up salons, and that they would wear a mask. So I think Judy's correct in assuming that she is this is the road they're going down, and to make sure that our hospitals and our businesses that will reopen, are gonna wear masks, kind of through these phases is what it seemed like, when she addressed that. So I think Judy and Daniel are correct in assuming that that she's already thinking about this, and if Lake County can open their courthouse in this anticipation. I mean, I don't think anyone is gonna say, from the governor's office, I can't believe you had them wear masks when she's the one hinting that I think masks are a great idea. And I at this point I don't think that you would get that much blowback for requiring masks. Safeway, most of Safeway workers wear masks and also gloves that they re-sanitize, and I don't know how that works with gloves, but I have a mask for myself and my husband that Lori Albertson makes, and we carry them. I carry both of them in my purse because if we do need to go to the hospital, I know we have to have a mask. So there are certain places that you put them on with. And I think we would be in this situation, you guys would be ahead of the curve. And when you are asking for that, you can say, we have already imposed this and we already have our community wearing this. So we're already ahead of this new game. So I think it would benefit most.
I think you're hitting, and Judy, we're all hitting what the struggle is. Sounds good. How do you go out to dinner with a mask on? How do we get that business open?
You're gonna have to wait until we can go out to dinner.
Yeah, I think this is to get that business open.
So
Yeah.
Face shields?
I think that as our call this morning with our representatives and everything, there's challenges for each business. You used a good example as our beauticians and those that are touching and right there, everything. But there's other businesses that need to open. That mask just doesn't fit, and the requirement is not going to fit. So when you say it's going to come from the top down, are we going to be wearing masks when we're at the sawmill? Are we going to be wearing masks when we're trimming trees out there and all that?
It's an assumption at this point.
There isn't one shoe fits all.
Mhm.
There is
Very
not.
true.
I have 80 masks for the sawmill, actually. They're going to start enforcing mask wearing.
But the migrant workers going to wear them. I don't know. There's so many things. It's great that the sawmill is going to do that. It's great if they're going to do that. But we struggle. I appreciate Daniel and Judy talking about how much time it takes just talking math. After we get past this and we move on to reopening Oregon by the guidelines that we've all received and everything. If we follow this guideline, it doesn't tell us you have to wear a mask. So we do all this, we get our plan together, and then in the middle, somebody from the top comes down and say, put mask on. Could become challenging. But it's frustrating at the least. I'm not opposed to masks, but
we all all societies make sacrifices during emergencies. We do it during times of war, and the issue is whether or not they're temporary or continual. I think this is going to be temporary as part of the first phase, and I think that our population is willing and comfortable with complying with some of these requirements and suggestions and recommendations for a period of time. We just have to try and get ourselves, if we go this route of requiring or even recommending, we go that route. We just have to know that it's part of the mission to get to a point to where those things are no longer required. It's not, our population is fine with making these sacrifices, I believe. But we just have to know that we're gonna keep moving forward with that. Get to a point where we can we're no longer putting all these restraints and requirements on a population that ultimately is actually our boss. So that's my perspective. I'm
Well,
just
going
trying to get to
back,
that
you
point.
know, it's gonna be really hard for the governor's office to deny our community to go back to work once we've met every step. And if we meet every step in the regulations and we say, we've met every step, we've done every phase that you proposed, and then they still turn us down, it's gonna be a lot harder to turn you down then too.
So that's a great segue. We need to talk about this. And so by this here alone, we have 0 cases. We have 1 case here we don't qualify because we have 100% more than we have today.
And that was a question
For
of
14 days. And so, part of the deal is that on our long-term recovery, that's why I sent you and Judy those text messages yesterday. That applies to our phases. Do we have enough PPs on hand? All this is part of the phase to get to phase 2. And so if we have all the PPs as planned, if the hospital doesn't have too many patients, you know, there's several different things. I mean, that's just one thing after another that we have to have done. But yes, and I see where you're.
So I jumped this out there. I think we need to sort of, I know the board isn't ready to make a decision on exactly how we're going to open up right during this meeting is for I'll use the word debate to find out where we're going to go, which we've done pretty good. But I want to make sure if there's any other thoughts on opening the courthouse and then move on to this. And I just wanted to brought this forward. Anybody else have any other thoughts on opening the courthouse? Daniel.
I just want to add on to the mask thing that it's going to be easier to require the masks now than later on. Than if the governor requires it later on, trying to get people to go back to wearing them to be required. You're better off saying, hey, we're going to open the courthouse, but we require you to wear a mask. It's easier to swallow that than to open it up and say we recommend it. That if the governor says no, they need to have masks. Now you're requiring it. It's better to just ease it off. Start requiring it, then recommend it, then go away from it. In my opinion.
Okay. Any other comments on opening the courthouse? No.
So even if you guys decide not to put a person in the hallway here, the lobby, maybe you could do some like tape, like kind of directing traffic towards the table and like have a little sign on it saying that or something, having the masks available. If you guys decide not to do a person, it might be a way just to kind of like cattle chutes, you know, like they gotta go by the table.
Well, great idea. I still haven't seen anything that guarantees masks are going to do it, especially if you're reaching a bucket of masks. You have COVID-19, how many other people will be infected by that? There's so many variables, but if we don't put a screen in there, I think that's a great idea to try to fund the people to go through it and read and get stuff, I think it's a great idea. If we decide to do that.
To be honest, I was kind of against the person. But now for right now, I think that would be prudent. And to have a person out there, they could hand the masks out, they could give information, whatever. I really do think it would be prudent now.
Well, and
Just
Even
for
just,
a short term.
right, in short term, I mean, we could do this for a couple weeks or whatever, $1,500, I think, you know, that's in travel budget for us, I mean, we could find that.
yeah, and we'd get reimbursed on it, but
Right.
that's the reason why we need to have the conversations with all of us, is for us to absorb that. We'll make a decision later, we won't make the decision absolute right now, we just, we have to public
No.
meetings to make those decisions, but this
Right.
gives us a
If we
chance
get
to
there.
debate it, to talk about it, to come up with what is the best thing for our citizens, and that's a very good point.
Right.
It's our citizens and our staff that we're trying to protect. And go ahead,
Can I
Melanie.
complicate it a little bit?
Sure.
So what about this employee's lunch breaks? Or breaks? Are we going to have someone in the department that can cover for them? How do you want that to work?
I'll volunteer.
That'd be up to your
As
department.
far as the person out there.
Yeah,
That'd be up to your supervisor.
Yeah.
Whoever their supervisor is.
Yeah, and we haven't even, good point, but we haven't figured out, I threw you two out under the bus, it could be that person works directly for the board of commissioners, and we figure out for them to get lunch break and their breaks. We haven't even went in as far as, are we gonna open up for the full day, are we gonna open up for a half day, or things like that. I myself see us open up for a full day of screening, doesn't mean I'm right, but we've had conversations that will lead us to hopefully help us make the best decision to move forward. But that's a good point. They have to be able to get restroom breaks and get away from there also.
I think too, that'll help out the circuit court, with rights and normalcy for the
Right.
circuit court, so
Right.
people, if we open the doors, flood the circuit courts, at least that way there's some kind of screening happening.
Right. Helps them out.
Whether it's the county's responsibility to provide that definition of access, it could be.
Well, what was really interesting, I heard the other day, I think it was you, is that other courthouses have security as a norm, so they're already set up to be able to do screening. And so this is out of our norm, which may be somewhat become our new norm. I don't want to really say that too loud, but we don't know what the new norm's going to be.
Exactly. So at least it'll provide some relief for the circuit court, some screening. Because we know Mondays can be a fiasco upstairs, depending on the number of cases being heard.
Well, and we definitely don't want down your area or the circuit court area where you cannot do the social distancing if they come into those little areas. You got a sheriff's window, got your window, there's not really 6 foot between people. So we have to set that up.
Until some of that's lifted, I don't think my staff are interested in really meeting with clients in the courthouse. I think we're more interested in meeting with them outside.
But there's people who want to come see you that might not be your clients that will be in your lobby.
It'd be interesting to see
Yeah.
someone want to come.
If we open up the door, the doors are open and public
Just
comes.
Not very many people want to come see us, but yes.
So any other thoughts on opening the courthouse, for us to absorb? So we're going to move on to the discussion on
Do we wanna make a decision on that?
reopening the courthouse.
Yeah.
I think that, we need to, as commissioners, absorb some of it.
I mean, we talked for a good hour, and I'm just curious, maybe we need to circle NJ and make a decision as far as, can we get something put out there for,
So,
you know,
if you have, or if you're comfortable, and you have a motion and you want to move forward, I'm not opposed to that either.
Well,
I'm not intentionally slowing it down, it's just, we've heard a lot.
Yeah.
And plus what we heard on the phone at 7 this morning, the governor's call yesterday and so on. My aha moment was last Friday whenever we shut this place down and I drove through town and I can stop at any other business that's open and I can walk in
Without screening.
without screening, without a mask. And we're more restrictive. We're more restrictive here than stopping at a business.
And the most complicated thing for us in shutting our courthouse down was the fact that the state upstairs is requiring us to make sure that people have access to the building.
Well,
So,
I guess what got me is why are we shut down? If in the last month, in this small community, just everybody that goes to our biggest business, almost everybody goes there once a day or once a week. And we don't have this spike of COVID-19. Why is the courthouse shut down? That's where I got to. Is if everybody in Lakeview is pretty much going to these businesses, there's two of the bigger businesses, and you can go socialize and see people there right now. And we do not have the spike that we were told we were going to have. Well, we may get it 2 weeks from now, I don't know, but we have not seen that. Why is the courthouse shut down? That's where my aha moment is. Why are we closed down to the public? We are public servants. Right. Every one of our departments is here to serve the public. Right. And why are we closed down? I'm struggling with that. I'm trying to find a way
good.
to open it back up.
So I'm comfortable with at least looking for consensus of the board that if we can have Jay put together some sort of a work description for that position, and maybe even each one of us can circle around with Jay and fill him in on what we'd like to see included, if we have anything to be included, but we'd like someone to be able to man the doors and see how that's going to work. And then he can come back to us with a recommendation on Friday when we're ready to make our decision and see where we'd like to go, if we want to make amendments to that, to whatever that work description looks like. But I'd like to at least kind of get Jay on that so we can keep moving.
I'm good with that.
Okay.
This is the board with Jay to what it look like to have a temporary position registration.
Yep.
This is the board.
At least we can.
We've lost Jay, he might have went to lunch.
Yeah.
But,
Yeah, no worries.
so.
Okay.
All right, so that's for reopening of the court. So we have this reopening of Oregon framework, and I think maybe we should hold off getting into that too far, and we should talk about the committee that we discussed, get formed, because I believe reopening Oregon framework is going to be a lot of the duty of that committee.
Right. Absolutely.
And so we tasked you last week to look at some recommendations to us of what this committee would look like. And you reached out. And so I would like to have that discussion now. The board would like to go that direction. Mr. Albertson, are you good with that? And because of we're either going to recess or continue working, because at 12 o'clock we have potential people for the committee.
Yeah.
So what were you able to start getting into place?
So, first of all, I think when we form this committee, I would like to have Daniel, I would like to have Judy, I would like to have a doctor from the hospital if possible. Teresa Squires is discussing this with the doctors. They had their meeting this morning at 10, where they were going to discuss more details of what we were talking about and the questions that we had. And hopefully we can get one of the doctors present. I would very much like to have one of them if they can. I'd be happy with all of them. But if we can at least have one of them come to us with the concerns of the individual doctors that they have for reopening or not reopening, I'd like to hear it. And I think that is important to have that included in the criteria, because it's specific. It is required, and other counties really haven't been able to do this. It has been a challenge, I would say, to be able to get that input from our doctors and our health practitioners. But, and to get to the point where that conversation can take place between them and the commissioners.
Well,
And so
I just-
I'm really happy that we're getting to that point now. We're ahead of the game in a lot of ways. We've got that.
I want to say I support that so much because reopening Oregon, the hospitals and the doctors are part of it because they're not open for business now.
Right.
And reopen Oregon means that healthcare has to get back open also for economics within our county. So thank you for that. That's absolutely paramount. and important.
The hospital is the biggest employer in Lake County.
Right.
So
Well, and we have been.
They start laying
discussion,
people off.
but we're concerned about the people that need health care. I mean, our hospital people across our nation are doing it the best they can under this COVID-19. But there's people out there that's scared to go get services.
Right.
They're not.
And so what are the negative health impacts from
And,
that?
and so the doctors and the healthcare is part of reopening Oregon. It is really, really important part of it.
Right, and we wanna make sure that we're being respectful of the doctors and everything else. So there's two ways that we could kind of do this, and this is my thoughts on this as well. That, first of all, the goal of this committee is to get us to a point where we can accept phase one, and we can make sure that we can meet the requirements in phase one. And that's the gating criteria, the core state preparedness, and that, those components, there's three components of each. If we can get to a point where we can review all of those and have our healthcare practitioners look at those as well and give us their feedback, and we can have this discussion through the committee, we can then have a recommendation for the full board here to sign off on what our plan is actually going to be. Those are the two main things, is the gating criteria and the core state preparedness. Yes, there are issues with that, with those things as far as definitions, because we obviously all have had our questions as to what some of these things mean. And, you know, I won't go into all of them, but there's vagueness in meeting this criteria and all three of these components. And that is something I heard last night in our IC meeting included, where we had some of our the medical staff at the hospital, they had confusion about what some of this was based on just the vagueness around it. I wanna make sure that when we form this committee, that we don't get into an area where we start tearing apart the framework. That we just look at ways that we can move forward and meeting the criteria so that we can propose a plan. And I myself have that habit. If I start getting into that area where I start beating these things up too much, I can have that correction take place. I think whoever we have sit on this committee, it'd be important to make sure that we stay on track and make sure that we just make sure that the focus is meeting the gating criteria and the core state of preparedness. That's our goal, to find out whether or not Lake County can meet those requirements and then pass that proposal on to the governor. And the second part of this is how we're going to structure this, because we want to be respectful of the doctors. I don't yet know what the doctors' full response is going to be, because they were meeting this morning. And if one of the doctors would be cognizant or willing to come and sit on that committee, I think it'd probably be better if the doctors could sit down with at least one commissioner, Judy, Daniel, and who we have on that committee. Basically, just to work out the actual framework and how we meet this. I think it's important to have our public health director and our OEM, and I think Amron definitely needs to be there because he is our IC. And then I'm still hoping, fingers crossed, for an actual doctor and health practitioner, so that when we have these questions that come up on the fly, when we're working through this process, we can ask that question and get an answer. And so we can kind of cut through a lot of the just the issues that we have when we're having to constantly pass information on to another or relay.
So I absolutely. I'm there, you know, we talked, originally, the committee being the board of commissioners and others. I think I'll just put it out there, James, you've taken lead, I think one commissioner in the committee can bring the recommendation back to the board of commissioners.
I would,
That's where I'm at, because I think it'd be more productive than sitting in a public meeting and debating things. I think the draft can get to the full board, we can look at it. I have one other recommendation, and it sort of hit me, is we should have somebody from the town on this committee.
oh, yeah, absolutely.
I totally
Absolutely.
apologize for not thinking of that before now, but we sort of get tunnel vision occasionally. But the businesses are within the town, a lot of them, you know.
Should we reach out to Paisley as well?
Well, I guess I'm throwing it out there.
I'd like to, at least to see if there's interest, if they'd like to have a representative from Paisley, because it's still part of our county and they have an elected government. And I think I'd like to include them in this process if we're looking at doing a countywide voting.
So, yeah, we don't, I'll get right to it in a second. But we don't want to get the committee so big, but we do need
I understand.
representation.
I just wanna throw that consideration.
I agree with you. Go ahead.
So going off that idea, what if you had someone like the chamber director who right now is open to all businesses and represents all the businesses in the county? That might be easier than trying to get a bunch of people from each community. Just throwing that out there.
So,
Not to throw Jessica under the bus, but
well, as of right now, we're trying to primarily stay with agencies. Right now, there is for economic development in chambers. There is an element of this. Right now, on the phase one, we really are going to be working at some of the hospital side of it and some of those type of things to go get there. I'm not opposed to the chamber directors. We have more than one chamber within Lake County, so we have to be cautious as we.
Well, the criteria only specifically talks about the elected government body and the health care providers. That's I think why, we're thinking the town of Lake. Go ahead, Jessica.
I agree. I definitely, what you guys have to meet, and I've gone through this packet, is working with your hospital and working with the county public health officer. Mainly, it's not going to ride or die with business plans from our business community. I do think we have a bigger reach business-wise than the town of Lakeview. So when you are incorporating business plans, I think that would be a good place for the chamber to enter, and even also Terry from North Lake, even though we're working with a lot of our businesses in North Lake as well, as Paisley, Adele, and Plush right now. But her input, I think, would be ideal when that time comes to where you are incorporating some of the business. We talk to our businesses every single day. We talk to them all throughout the county on several different fronts and several different conversations and long conversations that I've had with many of our businesses. I think it's important for you guys to focus on your criteria and then bring in, I don't think there's anything wrong with bringing in the chamber or the town after you've gone through this initial work of working with public health and the hospital. I
And
think
obviously,
you can.
we're always open to having the suggestions and that input from the chamber and everything else. And because once we finish going through this, we still have to come back to a public meeting with the board, or we have to still work this stuff out and prove it.
Yeah, I think bringing in the chamber at a later time, or select business owners at a later time, once you've kind of gone through all this, I think it would be a better use of their time and yours at this point.
Thank you. There's so many people that could be at the table.
Yeah.
There is so much. I mean, our churches, they want to know. They operate.
Everyone, I mean,
Every-
everyone does. You guys
everybody
have a
does.
large task at hand, and I think focusing on what you need to focus on, per what the governor is laying out for you, is smart to keep your committee small and necessary, and then to grow it over time when that feedback is
Because
It's
we
gonna
may
benefit
have,
you more.
we may have additional needs for that additional input in phase 2 and 3
Yeah.
as we kind of move forward.
Yeah, and it's your committee, and you can start small and focused, and then you can bring people in. I think that's a more manageable way to do with how much work you guys have ahead of you.
Definitely think you need somebody from the town and reach out to the mayor.
Right, so at least see if you'd like to, because it does specifically say the elected body and the local government officials, and then it specifically says that you kind of really have to bring in your healthcare system, and your healthcare providers. It's been an interesting road of getting there to where we can get that input, but I'm really hopeful and sanguine
I
that we'll
mean,
be able to get there.
you guys know how I feel about this. I've read you the stats and I've talked to Judy about the projections. I'm not gonna go into that again.
Yeah.
We're giving them a choice to get on board. And if they decide not to get on board, we're moving ahead.
Well, we kind of have to, but we have to make sure that we're asking for that input and look for that input in
The
whatever
problem is
capacity. it
we've
comes.
been asking for that.
Right, I know.
And
But
I
I
haven't
think
been getting them.
there's been a breakdown, and some of that's, it goes all around.
Yeah, but I think we're making progress moving forward. I really do.
In fact, I will guarantee you that we're making more progress on this front than many other counties. So I'm really,
Look at just the struggle we just had about opening the courthouse. We didn't talk about opening our fairgrounds or annex up north or other things that have to do with county operations, just the struggle in that alone, right, opening Oregon. So there will be struggles, there will be debates, there will be anxiety, there will be feelings hurt. But I do believe, and I appreciate Jessica talking about that it will grow exactly the way she said. You start small. As you get some of these things taken care of, that's whenever there will be, oh, we hadn't thought about this sector. And we'll ask, and it might be a subcommittee that brings that recommendation to the committee, to the town, and the county. But it will grow.
Everyone doesn't, I mean, you guys are working really hard. You have a lot to work on and work with, and I just think it behooves you and the rest of the people that would be involved, that we're not, involved in every single decision that's why we elected you guys.
right, and
So-
we serve
Have it.
we serve the town of Lakeview just as much as the town of Lakeview does. All the people that live within the town of Lakeview are still our constituents,
Absolutely.
and we are responsible for their safety just as much as we are for everyone else in the county. So,
Right. I mean, and when you bring in other people like the chamber and some business owners, if you want some, of that to bring in at a different time, I think that's, a really great opportunity for people to say, like, and to ask questions, to which I know James really encourages of his constituents. There's a lot of questions to ask in business plans, but there's also, I think, a level of, well, if I turn in my business plan, then they're gonna open me back up. And that's just not the way that it works. And you guys have a lot of, work to do to make sure that it's all in compliance. So I think bringing people in later and letting you guys do your work is a great idea.
So I have to say, our college, one of its representatives, other counties and everything, the disconnect that we're working on here is a disconnect at the state level also. We have boards of commissioners that's into the medical field talking about the hospitals and this and that without the doctors and the people in that profession at the table. So we've had multiple calls, 2 a week, with our state reps and state senators and commissioners throughout this district talking about what the healthcare needs. And we're talking with wind because we don't have the healthcare professionals at the table. table.
We're actually being asked to give guarantees that they will have a sufficient supply of PPE.
So we're dealing with that all
A lot
the
on your
time.
plate, yeah.
And so here locally, we're reaching out and we're longing for that. With that being said, within the healthcare, they have their world and they're not used to public meetings and all the things that come with public meetings. And there's an inherent risk when you're in the health world that governs them from getting involved with a lot of things. So there's nothing normal about this. And
Yeah.
so we're crossing some bridges today. And I think Lake County, we're really pushing, we're trying to find a way to make that work in unusual times. And I have to say, even with all the anxiety, I'm very proud of Lake County. I'm proud of our doctors, I'm proud of our government. We're going to get there. And I think this committee is the start to get that communication going. And that's my reasoning for falling back and saying one commissioner on this committee making recommendations to the board, because of people can talk more openly if they're not sitting in the public eye. And then you can debate, you can bring those things forward, and then recommendations come forward. And I'm not one for a lot of committees, but I believe that's the appropriate way for us to move forward.
And our doctors are not politicians, and I think that we need to be cognizant of that and protect them in every way
Absolutely.
shape we can.
I think it's very encouraging that you guys are working and trying to work and trying to bridge that relationship with our hospital and our local caregivers and medical professionals. In lots of conversations that I've had with our businesses, it's kind of a line where you go with the expert. If we were closed down because of a financial problem, we'd be talking to financial advisors on how to get us back up and open. Since this is a pandemic, people feel that it's the doctors that should be engaged in conversation. So I think it's really comforting and encouraging to know that the three of you are working with our hospital, and to have Lake County be aware of that is really important.
Well, this is we haven't stopped. Like we've been doing
It's
this from day
good.
one,
It's really good.
and this
Yeah.
is why I encourage constituents and the public to ask questions. And because we fly blind sometimes in knowing where the public's at, and trying to make sure that we're still serving them. And so
I think you're
we
definitely
have
on the
to
right track.
continue the discussion.
I'm going to put a shout out. We're very, very fortunate to have Judy on our team.
She's amazing.
We are very fortunate. A person very reasonable, has the connections, still works at a capacity for the county, also works for the hospital. We're very blessed to have Judy there for the person of reasoning, and so we appreciate you, Judy.
Thank
just
you.
want to put that out there.
We just got a text saying that Dr. Gallagher would meet with us if we could meet at 3 today at the hospital.
Okay.
Is what his schedule will allow
Okay.
instead of noon. Are you guys
Instead of noon, so
instead of noon? If we could do the meeting at 3 at the hospital so that you could join us.
okay.
So, I
You
guess
could probably
that
do the meeting at noon and recess and then catch him.
well, that begs the question. That is awesome. That is great.
That's
I
best
say,
news I've heard all day.
I-
So
I'm wondering if that would be just a committee person and who we put together instead of the full board.
is Amron able to make it?
So that text came from Amron.
Okay, so Amron will be able to.
I would assume
That was Amron's
So,
request for
And
Dr.
you
Gallagher.
guys are both good with that time?
Yeah.
I think we have our committee guys. I just have to reach out to the town and
So, well,
find out if anyone's willing.
I'm so confused.
So, 3 o'clock, that's why we're moving it to 12, but just moving,
So,
apologies, Commissioner, I'm moving past.
Keep up.
So, well, I want to be respectful of Commissioner Albertson and where he
No,
wants
we have to decide who
wants
we're
to
going
be.
to have as
be on
on that committee.
And I need to know if we're going to have the 3 o'clock the continuation of a commissioner special session, or if it's gonna be the committee meeting. And we haven't made that decision of what we wanna do there yet.
Do you wanna reconvene at 12?
Well, I don't know who's still coming at 12.
I don't think any.
So Amaron asked for the noon originally,
Right.
and now he's saying we can do it at 3 o'clock. That works for Gallagher. That works for him.
Okay.
So he's asking now, are we doing noon and 3? And I said we're discussing that right as we speak. So we're doing play by play.
Okay, sounds good.
I think to make it less complicated, I think do the committee, make it the committee. And that way the press won't have to go down there.
I don't even think I could even probably get in.
That's why I'm
Probably
saying
not.
I had a hard enough time trying to get to where Daniel was setting up the tents.
And that's what we need to do, but that's where I've gotten is, the committee can do a lot of really good work. So on the committee, it seems like the board is moving towards having this committee. And then we would appoint it, there's a process, we do that today actually. Within that committee, who's gonna keep notes and get the stuff and do the writing and get it to, so that the commissioner that's not there.
Can read the minutes and understand.
Well, our notes or whatever, because of, I would like for this to move as fast as the committee can push this to be sort of the lead in reopening Oregon. And so there's gonna be a need for, I'm assuming Mark and I to be able to review some of that stuff right away.
Okay, so when you say that
So what we,
leads me to believe that you've chosen me to be the
what do you guys wanna do with that?
because
Well, I don't wanna step on anybody's toes, you know, and vice versa, so if you wanna do it, I'm fine.
Well, let's put it this way, I'm not gonna be the one to do it. I'm more comfortable with, reviewing, trying to help with some solutions. Both you guys have worked more closely with the doctors in the hospital at this point. So, if you'd rather continue it as a group setting, but commissioners going to be all three of us, or we can pick one.
But then we go into the public meeting laws, so
Absolutely.
that's what we're trying to avoid.
Yeah.
So, it doesn't matter if you wanna do it, that's fine.
well, if I do this, I want to make sure that I can capture the full essence of all your concerns and
Well,
yours.
see, and that's what I wanna give you right now.
Okay.
Okay, so is there consensus, James is gonna do it?
But it's fine with me.
Not entirely.
If you don't wanna do it, I'll do it.
I can do it. I can do it. All right.
Okay, so my concerns, like I've told Daniel and everybody and Judy, who are probably sick and tired of me telling them. But I want you to take this
Yeah.
and show them the numbers in Oregon, the real numbers. I need to know in my own mind why the projections are so far off compared to what's really going on. I need to know the formula of why they're still expecting 11% of our population in Lake County is gonna die.
When we have 548,000 people in the entirety of 17 counties in the state, and only 130 plus cases,
Right.
with
Which is
0 deaths.
0.006% of our population with 0 deaths. Why is Lake County's 11% death? I need to know that because we need to close that gap. You see what I'm saying? I need to close the gap between what's really going on in Oregon, the math that's really going on in Oregon, compared to their projections.
Okay. I can get-
Because the doctors are not gonna go by to be part of our reopening. They're not gonna go to reopen when they're still 11% debt free. And I need to know how,
Nor should we
right, no,
consider reopening.
heavens no. If we're really thinking there's 11% of our population's gonna die, nobody in their right mind would wanna reopen. You see what I'm saying? And so I need to close that gap, James.
Okay.
I also need to know, we need to know the exact PPEs that the hospital has.
And they give that to us every day.
Okay,
I get a daily count, and Charlie sent, you got information from Charlie, somebody?
Not on
Did you guys
PPE,
get emails?
not on-
He replied to my email about reopening Oregon.
So he sent, an email, I'll resend it to you guys, it went to one of you guys. I wanna say you, Mark, it went to you because you were asking about the PPE, and, he
I'm
sent.
130 emails behind.
Okay, so it's in there. And what it is, it's actually very helpful. It tells the PPE they have, it tells the projection, it tells about they have access now to,
The
in business,
projection of what projection?
I think of what you need.
of
of what they
the
need.
projected needs of PPE.
I believe so. He was answering your question. I didn't read it 100%. I did read a part that said they have access now to N95 mask cleaning, and they can be cleaned 20 times now before they're disposed. So we have a system to send them in, get them cleaned, get them back. There was some information he wanted to get to you. So I will try to remember to resend that and get it to the top of your list so you guys can look at it. I'll include you.
So if you come across.
So, and I'll continue working on our phase plans,
Okay,
and
excellent.
as that goes on, I'll have questions, continued questions for you and the medical field. And then you could just be our liaison for those questions as we're putting our plan.
Well, I think the committee needs to focus 150% on this.
Right.
And
the PPEs are in there.
they are in here,
Yeah.
and they have to sign off. We have to respect them there. Your question on that, I appreciate exactly where you're going. I think maybe we put that in the format from the board, and that's a separate question than working on reopening Oregon. If we
Yeah, but the thing is that it does apply to this because,
it does, because
Because
we
that-
reopen it.
yeah, if the doctors recommend we don't reopen, we need to know why.
And we're still projecting these many deaths.
And I need to know that.
And
Because how are we gonna, the doctors are still saying a certain amount of deaths are gonna happen. How are we supposed to convey that?
They're gonna have to answer that in this.
Exactly,
And
and
this
so,
is built-
in reality, it does apply to our plan because they have to sign off.
Well, and the governor also made, go ahead, Charlie.
So you said that's 11, where's this 11% coming from? From
It's from the doctor's projection.
from here, Lake County doctors?
Yes, sir.
So that's what, 800 people in Lake County, 880? Right in
No,
there?
it's
It's-
of our,
It's
Of
of
a portion of our
our 70
population.
years and older.
so it's
So,
about 100.
There's 25%, and so it's 90 to 120.
I think.
Yeah,
Okay.
90 to 120.
We're just a little over 25%, 65 and older.
Okay. So it went by
It's
age,
11.
not total.
It's 11% of the population 70 years old.
So this is a question that I think actually does segue into this, and I think I can articulate it because the governor did say specifically that the counties that have 0 cases would be taken under a different consideration for reopening if we did in fact get 1 case within that 14 days. And we would be treated somewhat differently. There's only 3 counties that have that, but there's 5. Is there 5 that have?
There
There's
was,
five.
cases?
I
There's
think there was.
Okay, I
As of yesterday, anyway.
Okay, alright. I thought there were 3, but No, you're right.
Well, when I did this,
Yeah.
it was fine.
5, okay, sounds good. I just had the wrong number in my head. So if those counties are going to be treated differently because they have no cases, and that's actually something specifically listed for this plan being approved for our county reopening, how does that mesh together with when a county, even though it has 0 cases, has a projection for 11% loss of life over a portion of our at-risk population? I can see where you're going with that, and I think that that's probably a good way to articulate how we're trying to understand this when we make a recommendation that we feel is necessary to open. Okay. I had to throw that out
I
loud.
get exactly where you're going. Why would we open if
Absolutely.
that projection is there?
And if people think this, they're gonna think we're crazy and we have no care in our elderly population. And so we have to figure out this.
You have to figure out where the doctors are coming from, so then you could, if they convince you, then you convince the public.
Well, and I just don't understand what's really going on and what their
And this
projections
is what
are.
I've been asking.
And
But
there's such a gap.
This is the start of getting the key people together, and I really appreciate you acknowledging that we will get further by having one commissioner of the committee and going forward. I appreciate that. I got to that a while back. But anyway, I appreciate that you're there too. I really think that we're going to build that and fill those gaps through this committee. I hope that that's intent, so yes. On the committee, I see what you recommended is Daniel Judy, that's IC for the county, that's our public health director. A doctor are the representation.
Okay, to stop you on that deal, we have to have a doctor that represents the whole medical community. You see what I'm saying? I don't want one doctor saying the sky is falling and the other one saying he needs to open up all the business.
That would be a question I can ask the doctors, whether or not he is being, Dr. Gallagher, if he's being representative of all of them.
I think
Yeah,
that easy.
I'm sure that they're coming united, but you could clarify that just to make sure.
And so, Amron is IC for the hospital. Commissioner Williams, and you will reach out to the town of Lakeview and the city of Paisley for elected representation.
To find out if they have interest or whether or not they just like to be included in the loop it once we get a recommendation.
So, we need to set that up by motion and second right now. And then that will be fluid as needed. We will add people to that committee. It will be a Board of Commissioners committee that reports and makes recommendations back to the Board of Commissioners. They are tasked with bringing the criteria forward for reopening Oregon.
And meeting the requirements of phase 1.
Are you good with that? So moved.
Seconded.
Aye. Further discussion? All in favor, say aye.
Aye.
Motion carries. So,
Yeah, that's what it sounded like.
now that when I threw it sideways back, are you going to keep notes and give to us? Do you need somebody to set in and keep notes?
Here's
Does
the
the
further
hospital have
discussion,
any?
as always. Daniel, you were raising your hand.
I'm willing to
when
take notes.
You're willing to take notes? Okay, I was
That-
wondering if that's what your
I mean,
hand.
I always take notes anyways, so.
Okay, alright.
And so Judy and Daniel, I apologize that I've been a pain.
I don't think you're a pain, that's all
You're
about
not.
working together.
But I'm just
Addressing
trying
everyone's
to get-
concerns.
I know that I'm laying a lot on you guys all the time, and I appreciate you guys just getting right back to
No
me.
worries.
And so,
You are my boss.
well,
Don't
Do I have an
ever admit
option
that
to
in a
say no?
public meeting. He fired Jake earlier today.
this was Jake's last day, so.
No, I appreciate a need for information, so you can relay that. That's not a above and beyond request to ask. You're asking for information so that you can be educated with your communication.
So,
It's all good.
so Mark, for your information, I call and text Judy fairly often, and Daniel not near as much, and she's very responsive. So we all use and
He
abuse.
gave her a glowing review. We didn't even bother with you.
No.
So-
I
No,
I
it's all
tell them
good.
both how much I appreciate it.
I've seen
We
Daniel
love you guys.
I
do
just
the
didn't want to do
social
it in public
distancing on
meeting.
Saturday.
I didn't want to get it
Yeah.
I just am waiting for one of you to volunteer to take my spot on that board.
Not happening.
So on a side note with you two, if there's something that we as a board need to do differently,
Okay.
we need that feedback.
We'll
also.
listen. I'll listen and let you know.
I think just getting a doctor to a meeting is huge for us, and this will be a good step in the right direction.
Well, I tried to do that last year.
Yes, we did.
Yes.
But we
Been trying.
we're doing our due diligence,
Yeah.
right?
It's just taking some persistence.
We tried.
That's right.
So we have a committee formed, we have direction for the committee. Very encouraged about that. So that's done and over, someone come back. Do we want to, do a special session in a day to talk about where we're gonna be at in the reopening the courthouse? So I've come full circle back to that, because we got consensus to have looked at for a job description / temporary person.
The problem with that is by law, that's 2 weeks out.
Not temporary.
Okay.
Yeah, temporary is pretty quick.
Okay, copy that.
That's not a problem. Jay may even have some people that apply for other positions that might fit.
And
You know,
Sounds good.
so, we could,
you want to give it to me.
how long can we recess a special session?
You don't think there's one?
So we can recess and come back in tomorrow.
Oh, I don't think you can do that now.
Oh.
I thought you meant you wanted to go to
Bam.
lunch and come back. I'm like, yeah, that's fine.
Okay,
Well,
so
the thing is
we can
that
come back under
since
emergency.
But
Yeah.
this, the
Because we are in an
the,
emergency.
the committee can give us the information, so we don't really need to bring it up. I mean,
Well, we have to make a decision on it.
So how about we make a decision? And I'm gonna throw this out for discussion before the decision, is it seems like there's consensus to do screening and recommendation for masks, and get that mask available. We have consensus to have it reviewed by our HR of how we can hire somebody. Why don't we just go ahead and make the decision to do that contingent upon following the hiring guidance? If we're all,
as soon as he gets somebody, then we can.
and they work under the direct supervision of HR, I think would be, I've come a little bit circle, because it's sort of unique to, as far as the HR side for HIPAA and anything and all that kind of stuff. Guidance from the commissioners through HR.
Jay doesn't have enough to do the way it is, so I'm perfectly comfortable with that.
I knew where you was gonna go, but I'm trying to follow the synergies of a person in
I
each
understand,
situation.
and I, all joking aside, yeah, I
I agree.
concur.
So, when do we want to open the court?
You want a motion on that?
As soon as he gets somebody
As soon
hired,
as we get someone hired.
Let's-
Yeah,
let's
that's,
hear the
yeah,
motion.
right.
I make a motion to open up the courthouse as soon as the HR department hires the person for that role.
Second.
Motion's been made and seconded for the courthouse to be opened through screening and recommendations of face masks. Is that what they call it? Face shields?
Masks.
Face masks.
And as soon as we're able to get that person hired.
And that person can give out other information that's needed.
Yeah, absolutely. Any further discussion?
Nope.
All in favor, say aye.
Aye.
Aye, motion carries. Jay's
So-
not even here to know what he got.
So before you adjourn, Brad, I'm gonna make, so Kelly Similic, who owns a screen printing business in Jefferson County, he's also a commissioner, ordered 5,000 masks. They look similar to the one that Judy wears. They're all black or they're all white, or they can come in different colors. But what I was thinking, and I'm thinking about doing it myself as a donation, but to order like 100 of those, and I'm gonna have you print Lake County Strong on the map, or on the mask. And would you guys be okay with that if I do that as a donation?
We can't tell you how you can donate.
No, but I don't wanna overstep.
It doesn't offend me.
Not at all.
I think it's lovely. I think we have lots of community members that are donating, and I think it's great.
How much are they? Mask? How much are they a mask?
And do you know when you can get them?
He's already got the mask.
Oh, nice.
And how much for the print?
So it's.
Yeah, that's great. If he already has
They're
them, that's
about
wonderful.
$5.
Uh-huh.
By the time you print it, it's on it.
Yeah.
4 something, 4 and change. The mask cost him right at $4.
So I hear that for work, you can't have a full beard. I don't know if you guys.
That's if you're wearing the N95. No, that's correct.
So,
Sorry, Brad.
I'm not
Correct.
getting a haircut or shaving until the barbers
I'm
are
on
open.
strike. I'm on strike.
Yeah, but Judy, are mutton chops allowed with the N95
Yeah, right, I
mask?
know, I just think, yeah.
I
Did you- are you guys ready for me to
learn
adjourn?
from the fake news?
I'm ready.
Are you ready for me to adjourn now after that?
What are you doing?
We will adjourn at
I have
18
a
minutes to
Chinese
12.
maybe.
Anybody left on the phone?
I haven't,
No Chinese.
well, I tried it once
We're
before,
adjourned,
pick
or
somebody
you
to give